Hi, this is Suzette West, the Meaningful Work Maven. And with me is Ana Adams-Davies of Tushka, Ohoyo Adams-Davies nonprofit organization. And their mission is, and their primary focus is to increase the quality of life of individuals who suffer from homelessness, substance abuse disorder, and mental health disorders. And the topic of today's interview is the transformation of self from addiction and recovery, because this is a big epidemic. There are many individuals who are suffering from homelessness and addiction, and this is a very, very important topic. And so therefore we are having this important interview to discuss it and to open up the discussion and dialogue and hopefully spark an awareness and expand it within the community. So Ana, I want to go ahead and let you introduce yourself and just start speaking about what you do, and I hand it over to you.
Thank you, Suzette. Well, my name is Ana Davies. I was a 14-year-old mother, teen mother, suffered from, addiction, anger. I had a lot of issues in my life as being a young mother with a child. And I had a lot of traumatic events in my life, and I didn't address these issues until I was 32. So my life was miserable because I thought I knew everything, didn't have coping skills or tools to deal with the issues of life. And what happened to me one day, I received some news from my firstborn child that I had at 14, and that pain was so traumatic and so hurtful that it caused my change. And I had wanted nothing to do with addiction. I didn't want to feel that pain. And when I received that information, I received it while in state prison. And so I was there for 3 years with no help, having to sit with this pain that I never wished on a mother. And when that happened, 4 months prior to being discharged, I was able to go to a program and get the help and start working on myself, internal self. And when you're battling addiction, it's not only addiction. Addiction is just a Band-Aid that covers up the true feelings of individuals. There's more going on within an individual, that they use drugs to mask those feelings that they don't want to feel. The important thing to know when you're transforming yourself from addiction to recovery is being honest with yourself, knowing what you want, what are your goals. You know the pain that addiction has caused. You don't want to feel that pain anymore. In order to overcome that pain, you always got to remember it in a positive way. You got to turn those negative feelings into a positive, and that keeps me in my recovery today. When I started working on myself, there was no one around. I was honest with myself. I told myself I would never let addiction take me, mask me, distract me for what I need to do and from myself. So that was the beginning of my battle, and I wanted recovery, and therefore I was honest and I was working hard. And when that process started, then I was released into society, and I said, okay, I don't know how to live out here in the real world without any tools. So I put myself in a residential recovery program that was in society. And that's where the real learning started. This program has taught me to deal with my emotions, to cook, clean, just the basic life skills and coping skills and stress management, because in life there is stress. And if we don't know how to manage our stress, then we end up going back to what we know. And as this transformative process that I was going through, I was focused on me. I knew that I didn't want to hurt or feel the way I used to feel. So when I started my journey, I knew it was going to be a lot of work. And in the process of this journey, I was able to identify where everything stemmed from. My self-identity, who I was. Why did I allow other people's rejection and their own issues? Why did I make it my own? Well, because I had a low self-esteem. I didn't feel like I was worthy. I had a child and I love my child. But then today I can say, how could I love someone else if I can't even love myself? So in this transformative process, I graduated the program and I started educating myself. Okay? So just keep in mind that I was 14 and a half when I was pregnant, got married at 16, selling pounds of dope with this older guy that probably should have went to jail because he was 18 and I was a child, right? And I'm dealing with all these traumatic events throughout my life. And I had to face it, right? I had to be able to look at it. Okay, what is going on? So when I went to school, education is a huge thing for me. I wanted to learn. Well, where is this coming from? I started doing my own research within myself and started looking, okay, well, this makes sense. Oh, behavioral, observational learning, and then family dynamics. And I started, this all makes sense. I've been in school since 2008. I currently hold 6 AA degrees. I have a bachelor's in human development, emphasis in counseling, and I have my master's in public health, and I'm currently in my PhD for community health, public health. I have fought these challenges to get where I'm at today, but my motivation to continue was that pain that I endured. And then I started seeing people dying. Young kids committing suicide, women beat up. I mean, just negative consequences and effects after and over and over and over. People are and they're stuck. They're stuck in this lifestyle because they don't know how to get out of this lifestyle. But then also, some people are stuck because that's all they know and that's all they want. Addiction is a culture in itself. When you have homelessness, addiction, and mental health issues, you have to be able to address all three together. Mm-hmm. There's the addiction in hopelessness, right? There's an addiction of worry. Mm-hmm. Forms of addiction. And in order to look at this, one must look at self. Mm-hmm. I currently am a substance abuse counselor. I'm a KDAC 3. I currently go to work every day, well, Monday through Friday. And each time that I enter work, it's a battlefield. It's a spiritual and emotional battlefield that we are entering because I deal with a population that is ostracized, that are belittled by society. They're mistreated. And so they have a bias towards addiction treatment, mental health treatment, just because of how society treats them. And when I'm working with, and I've been working with these individuals, a targeted population, there's one thing that I'm finding that is a problem. But mind you, I have the experience. I went through addiction and criminal behavior. And my change was, everybody's change or motivation for change is different. All right. But I was able to turn my negative lifestyle into a positive and to promote healing and motivation within others.
Right.
Currently, right now, there's an epidemic with homelessness. There's an epidemic with mental health. And there's an epidemic with substance use. And we have individuals that come to us that were referred to us by, legal system. People can refer anybody to us, right? And I'm seeing that how an individual perceives self distorts the perception of the world around them. So if they don't feel like they're someone special and they're struggling, they don't want to fight for their life because they feel hopeless. And as a substance abuse counselor, my only job, and it should be, you can't force change on people.
Right.
You got to promote and be creative to promote self, right? Internal motivation, and make them feel like they're special, because we are humans. We have to feel like we're connected and we're wanted. However, we also need to have that, they need a little spark of, motivation, creativity to get them to get that motivation going to make change.
Right.
And when I have my clients and I talk to them, I got to let them know, hey, what do you want? How can I help you? Because that's the first sign that I'm here and I care. What are you struggling with?
Right.
I always tell them that this is a battle. However, you're going to do the footwork, but I'm going to give you the tools. I'm going to be there to help you. I can't do your footwork for you.
Right.
But I'm here. Right? That first initial interview with people that we meet is important, because if you mistreat them or they feel bad because they don't like the way you treated them, then they're gonna back away.
Right.
This epidemic, as the public health in me, the masters of public health, we are going about the epidemic the wrong way. Yes, criminal justice system and, human health services and all that, we have an issue, but we need to look out, well, why is that issue there? We need to look into it more, develop policies that don't discriminate and create a bias towards this population. I understand the legal system and, all that has their ways of doing things. And, some people do get, sobriety and recovery by force sometimes. But if you look at it, we're in an epidemic.
Right.
It's probably 2-3% that change. And based on my employment, I have been analyzing the problems, and I'm seeing, okay, what areas could we improve? And that's why I designed my nonprofit organization, Tushka, Ohoyo, Adams-Davies, and it's called Warrior Woman in Choctaw language, because there's issues that need to be set up. And the program is designed not for treatment, because there is treatment out there. What it is it's in line with Housing First policy that was created by the federal government. House these people because they need housing. Because you cannot be homeless and think change is going to happen. Your basic needs need to be met. And when we get the basic needs met, then we can go to the next level. We have to meet the population where they're at, work with them on an individual basis. So my program that I designed is a transitional shelter. And what it's going to do is, okay, so someone's homeless. Okay, we take them in. We do an intake on them, which is basically through the ASAM, seeing their biomedical, cognitive behavioral, see if there's mental health, their recovery, readiness, and all that good stuff, right? We get them in, we get them health screened, we see if their health is good, right? Based on their intake and assessment, then we're going to go ahead and refer them out to other places to get the help that they need, but in the meantime have a safe place to live with our program. And that is important because right now we have to turn people away. Well, where I work is an outpatient treatment center. I have no place to put nobody. If someone needed detox, I have no place to put them. We have to send them back out there because the shelters are full. There's no emergency place to put anyone anywhere. And detox, someone needs a detox. Of course, you have someone homeless. They're under the influence. They need to detox. We don't have enough detox centers to put them in. So my program that I've designed, I kept it simple, and to where hopefully later on down the road, I will connect a detox to the shelter so that, okay, I have someone coming in, then I'm going to go ahead and put them in detox and then get them going. So then we can work with this person with a clear, coherent mind, right? And because we don't do treatment, but we're going to have self-help meetings. And now self-help meetings would be from meditation, building your self-esteem, how to cook, how to clean, how to budget, life skills, right? And also self-help meetings that focus on building internal self-motivation, loving self, knowing that you're worth something. Right? The reason why treatment would be referred outside is because, we're going to keep it real simple. Because when they go to substance abuse treatment, okay, now they're working on their other things and for substance use and all this good stuff. When I refer them to mental health treatment, they're going to go there, and if they're diagnosed, because, I'm going to say there's about 75% homeless population that have a mental health diagnosis untreated. Mental health and substance abuse go together because those create the homelessness. Right. And they're going to go to the people that are professional and licensed to get the right treatment. When it comes to health care, someone that has diabetes or has a chronic illness or anything, any kind of infectious disease, we'll refer them out to those clinics to get the help that they need. These are areas that all need to be met. We need to look at this because by doing this, we will be able to increase the quality of life of individuals. And not only that, they will start loving themselves and start realizing people do care, and I don't like that life I'm living, I want to change. And then you start building those little accomplishments, and then it starts building their self-esteem. Once they get their treatment, if they're able to work, get them work. If they can't work, okay, then see if they qualify for disability, Social Security. It's a process. It's problem solving, and it's meeting all the areas that need to be met. Because if you have somebody that says, hey, okay, they're a substance abuse treatment, but then has a mental health issue, right? It's not going to work. They're going to go back to relapse. They're going to go back to what they know, because there's not a balance. We need to find the balance in this. Right. And that's where my nonprofit organization is coming in and doing. My program is a little different from everybody else's, and it's based on, because of my life experience, my education that I have, and I'm currently working in the field, and I'm seeing where the needs are. And this, if once I get this going, I truly believe it's going to increase the quality of life of individuals, and it's going to improve the community health. Right. Because you got to remember, mental health and substance abuse and homelessness cost taxpayers money. Yes, it costs us money, and I'm able to present this design, this program, to where it's going to be able to decrease economic costs, increase the quality of life of individuals and the community. Right? We're going to be able to provide a service. And also, I need to say this too, the delivery of service is important. Right. working in this field, I have firsthand witnessed discrimination, bias, the delivery of the system making people feel bad.
Right.
And we can't go into this field like that. Because if you think about it, it's brokenness inside. What we feel inside and we're broken ends up affecting our community and the world around us by our actions.
Right.
What we perceive, self, promotes an emotion. And then depending on the individual, that emotion, probably 95% of the time, activates behavior.
Yeah, it's like an energy, right? It's an energy that can be felt. You feel when you're being judged. You feel when someone is, looking down on you. And, that's not very motivating, is it? It's not very loving. It's not very compassionate, right? And you need compassion for a real solution. Right. You need to have compassion. And I see that in you. And you're very, very passionate about your work. And the level of compassion that you have for the people that you work with, and the stories that I've heard you mention about the people whose lives you've helped change because you were compassionate with them. And I see, even in where I live near Seattle, and in Seattle there is a serious homeless problem. And every time there is, they have to keep moving this population, because wherever they go, somebody cries foul in the neighborhood, and it's like they become this unwanted, like it's really makes it difficult for them. And I can only imagine how they feel, and my heart really goes out to them. So speak more about that too. Well,
you have to understand that when people deal with rape, abuse, been hurt, bad, in different ways and forms, there's different ways and forms, they think that something's wrong with them. And in reality, and the reality is that it's the other person that has an issue, is, sick, and has that cycle. The cycle continues on to the next, if it's a family member, or even if it's not a family member, like outside people, right? You don't even know when he tries to hurt you or something happens, right? But it's a cycle that is happening, and then we make it our own, and we hold on to that harm, and we remember that harm, and then all it does is grow within us. The hurt and the pain just grows and grows and grows and grows and grows. And then we need some kind of relief. We need something. So we reach out to drugs, right? Pills. And it's a serious issue here. People that I have come across and I dealt with have a lot. I want to say that 100% of people that I come across have experienced a traumatic event. And it's painful and hurtful to them. And that we don't have the tools to deal with that. We don't. We're not born with a manual. Hey, this is when this happens, this is what you do, or this is how you can look at things. No. It's until that negative consequence in their life, that they're either it's forced to treatment, whatever the case is. That's when they're in my group, in my class, I'm able to give them some life-saving tools and coping skills, right? And a lot of people feel comfortable opening up to me. And when they open up and they're able to speak it out, then it loses power. Now, a lot of clients that I meet up with, I introduce myself of who I am, what I've been through, what I've done, my life. I am not ashamed of me. My past is my past, and I'm an open book. I don't hide nothing from nobody, because I don't need to, because I'm not ashamed of myself, because I love myself. And I guarantee you, sis, that they look at me and they're like, wow. I give that hope with just my story. I give them hope, and they like, if Anna can do it, I can do it. You know, I have to, when I speak to people, you know, I listen to them, give them that attention, and they'll tell me something negative, and then I'll go with something positive. Whenever I have, you know, and we go back and forth, you know, and then they're like, oh, right. Then it's like a little light has shined in them, a little spark. Now, people relapse because life is hard, and maybe the you know they're not being honest in their program. But when I tell them, when you're fully honest with yourself, I was like, recovery is going to make you work.
Mm-hmm.
Okay, this is what I tell them. Addiction had nothing to offer you but pain and misery, and you're tired of it. So hey, that other side, recovery, just can't hurt to try.
Mm-hmm.
That's that little hope. That's all I need. Just that little bit. Just getting them to even just give me a little, if there's a little opening that I can, you know, they have that little hope, I can get in there, and then I can give them these tools, this motivation. It has worked.
Right.
I have helped a lot of people, okay? And I tell them, recovery is going to require you to work.
Right.
It's like going into surgery, opening the inside from out. So you have to heal from the inside out.
That's right.
Heal. Okay? I use metaphors, I use parables with them, and they understand, you know. Life is like a puzzle, and it depends on how many pieces you have to pick up. However, you're not alone. You know, we're here to help. That feeling of connectedness and feeling wanted and someone cares is huge.
Mm-hmm.
It's huge.
Mm-hmm.
It's really huge, you know. To feel like someone really cares about you is something important. And I'm going to give an example. I was at the store, and there was this older male, really older, you know, asking for money. You know, I said, I don't have money, but I gave him a card, our homeless outreach card. And I said, here, when you're ready, you need help. We can help you change back on track. And I proceeded to give him a hug, and he started crying. However, the people that were watching or looking, they were like looking at me weird, but I didn't care, because I am displaying human kindness to another human being. Mm-hmm. Right? That is what's needed right now. Just showing that we care, that there's someone that's there, you know. This is why in my dissertation for my PhD program, it's going to be, I'll be using it at my transitional shelter. And I will be using the CBPR model, which is community-based participatory research model. And this model, what it is I'm inviting the targeted population, homelessness, people with mental health issues and substance use, I'm inviting them to be a part of the solution. And what that's going to create is empowerment, community engagement, feeling like they're a part of something bigger than themselves. The people that I've already helped want to be a part of. Mm-hmm. They already told me, when you're ready, we are ready, because we want to be a part of this big movement. Mm-hmm. EBPR in substance abuse treatment and mental health is not an option, because people think, oh, this is what you have, this is who you are, this is what we need to do. No. It's a power sharing, mutual respect for each other, organizations, criminal justice system, all these big organizations working together with the population we're trying to help to better understand and coming up with a solution. This is huge. It has not been done in substance abuse treatment, homelessness, or mental health. And you know why? Because the people who deliver the service believes that they don't know. They're not coherent enough to engage or to make decisions. However, I beg to differ on that. You know, you have to get the right people to know, and it's like a multiple effect.
Right.
You know, people come in, I don't even know who they are, but they come off the street. Oh, I heard about you, Anna. Oh, good, nice. Your name is good on the street. Oh, okay, thank you. Well, that's my job. I'm here to help. You know, when you treat someone well, they're going to remember that, and that's going to make them feel good. Like, that is an issue in this field. Suicide. You look at suicide. Why do you think that happens? How an individual perceives themselves. If they don't love themselves and they feel like nobody loves them, right, and they're broken, they're broken within themselves, they feel like they have no hope.
Right.
Right? With mental health, yes, there's pills for mental health, and that's good. However, if you give a pill to somebody and they don't value their life and themselves, do you think that pill is going to work? No.
It's just a Band-Aid. If that.
Correct.
Yeah.
But if you give them the pill and it helps balance, right? It brings that balance in there, and then you start giving them this positive self affirmations and exercises, and you work with them. Hey, you're a strong person, and you know someone outside telling them these things, and then they start to believe it, and then they start to grow within themselves, and then they realize, hey, I'm important. You know, change is possible. Just like I tell everybody, addiction and recovery are always at battle, and it's not okay. It's not only a physical battle; it's a spiritual and mental battle. And the battle is because self, what we feel about ourselves, self-love, it's always. That's why we're going back and forth, back and forth, back and forth. A teeter-totter here, right? We relapse, we get clean. Relapse, we get clean, because we have issues in here that we need to pull out. So not only scientific evidence with medication and all this, but it's also spirituality and how one perceives himself and realize, hey, I'm important and I want to change. Right? Sometimes that, you know, addiction, like I said, comes in many forms. And some people like that pain, and so they hold on to that pain, and it creates more problems.
Right.
And that pain, and it just grows, and it ends up someone dying from an illness, killed from their addiction, right? Or suicide. They say jails, institutions, or death. I'm telling you, it's death. Because our self, in addiction, we're dying. We're broken inside. And that's why we do all these things we do. That's why we can't think straight sometimes, because life is so hard, and it breaks people. Being your socioeconomic status can break somebody, depending on the individual. You know, it will break you. It will mentally break you if you don't have food, if you don't have money. You don't have clothes. You don't have, especially safety. If you don't have a place to live and a safe, secure environment, that is going to have an effect on somebody.
Right.
That will break somebody. And so today, there is a lot of things that California is doing to organize these, you know, address these issues. You know, California has that organized drug Medi-Cal. Well, okay, so now access to substance abuse treatment is available through Medi-Cal. Recovery residents is paid through the Medi-Cal to get these, you know, get them housing, get them treatment. So California has started the process, and in San Diego, it started July 1st. And it's a going, and it's, you know, fine tuning, and you know, it's going to work, but we have to be able to give respect to this population.
Right.
We have to be able to show them that we care and not make them feel bad.
Right.
Outcast. I know what it feels like to be outcast.
Yeah.
I was a very, very, very messed up woman. You know, for an example, in my addiction, when I was very young, I would jump off of cars if someone looked at me crazy and hit them in the face. That was bad. If I had a gun, just point them in their face. That was bad. I had so much anger, hurt, and pain within me, and nobody knew my pain. Nobody knew what I was going through because because if you told somebody, that's a sign of weakness, right? The street codes and all that stuff. And it was, I see myself and I was mad. I was mad. I was mentally not stable, but it wasn't because I had a mental health issue. It was because me, the stuff that I had to deal with at life, things accumulated, and I got older and things started getting worse. And when my daughter told me that devastating news while I was in prison behind bars, it broke me. It broke me to my core. I cried 3 weeks straight in prison and by myself, and nobody knew I was crying. I had to sit there, and I was humiliated. Because, I was humiliated, it humbled me. It took pain like that to make me change. This is what a population we're dealing with.
Right.
We're broken. That's why I'm creating this book, Brokenness, the secret battle of addiction and recovery, because there's more to it than just scientific data and analysis. It's spirituality. It's what one feels about themselves. I go into work every day, fighting for lives, and I'm creative, and I do have my boundaries. I do put I know when someone's ready and when someone's not. I was a challenge. I was bad. And I'm able to get to, honestly, since I have been being a SUD counselor, I have been able to reach the hardest people. I've been able to reach out to them because my story has power. When I speak, it has power because of my passion, my change. We have to be able to address this issue. And this issue is just more than just one category. We have to find the balance and look at it and problem solve. To stop death, right? Mortality rates are up.
Yeah.
Right? Morbidity rates are up. Economic, stress. We're in distress. Money's, I could save a lot of money if people gave me that chance. Cities, counties, if we did it this way, because prevention costs less than treatment. Right? Because when we talk about prevention, you're homeless. Okay, let's get you off the street. Let's get you going. Let's address these issues. However, when they're already in their addiction and they're already sick and they're already got these things going on, right? You have to pay for the treatment, and it costs us more money. The homeless people don't have health insurance. The homeless people don't have an income. We're taking care of them. To a certain extent, because some homeless people have a social security, they get SSDI or, all that good stuff. But, we're still spending more money.
That brings a question to my mind about the motivation of some of the services to be more concerned about money and how much they can make. So the motivation to, maybe not be so concerned about seeing someone heal as much as you know,
That's real. That's out there. I see it all the time. And, it promotes a little motivation within me. However, I can't worry about what other people do or other
right.
organizations. I know what my organization is going to do. And because our heart is true to reduce human suffering and focus on humans, on human increasing the quality of life, it's going to be blessed. It's things are going to happen because my organization is going to be a role model for others. It's a blueprint.
Right.
It's a blueprint. As an SUD counselor, I deal with the individual. As a master of public health, I look at the population. As a PhD in public health, community health, population. So I'm able to do everything that I have designed in my organization. I've already done it individually, right? Now it's time to take it to the next level, on a macro level, to provide services and address these issues so we can promote a long-term self-sufficiency, do not return to homeless. This is the key. A lot of the programs that they do have out there that help with homelessness, the delivery of the system has been an issue. For an example, the housing vouchers, they pay the first month and deposit. Okay, you give them the money to get the place, but then how are they going to pay for monthly rent? Do they have a job? They weren't really frugal, and they weren't really organized and structured when it came to passing out these vouchers to the homeless population. It worked for some people, and you're talking millions of dollars.
Yeah.
Millions of dollars. They're out of funds right now. There's no funds until July 1st. So everybody that's homeless, there's nowhere to go right now unless there's an opening in an emergency shelter or a transitional shelter right now.
So you mentioned California, but I would like to add that this is not just a problem in California, that this is actually a big problem across the country. And I know that, like, for example, the city of Seattle is really struggling with this problem, and there's people out here that are really trying to raise the bar as far as creating solutions for that. Can you maybe lend a word of wisdom to the people of Seattle in regards to dealing with this homelessness and addiction issue?
Well, the main issue is housing first. You have to find a safe place for them. Now in Seattle, I don't think they have a Medi-Cal thing going on yet. California has the Medi-Cal where people who are on assistance have access to these services. So, that's California is being, is trying this out. It's a pilot study. With Seattle, this is, important is you got to house them first. House them first. And when they enter in the housing, screen them. Right? There should be organizations, programs out there that help with the low income or poverty population. Okay? If there is, you refer them out to get the services, but have a house for them to come back to sleep in, a safe place environment. That's priority.
Right.
Because if they have nowhere to sleep and they're on the street and they're hungry, change is not going to happen.
Right.
If you need to fight for grants, I'm going to say this. If you don't have those kind of programs there, also, then negotiating with other organizations to provide services, right? Going over and beyond, right? To these other come together as a community in order to address these issues. Learn, education. There is money out there to help people. They make you work for it. You're going to have to write a grant. You're going to have to go after that money, do some fundraisers, get the community, the federal government, the state government, the county government, all involved on the same page to address these issues. Because it's not going to work with just one person doing it.
Mm-hmm.
Because there's a lot of people out there.
Yeah.
Connecting agencies together and the population working together to find a solution is crucial.
Mm-hmm. And if it doesn't get addressed, it's just going to multiply and grow and become more of an epidemic.
Yeah.
You know, just when you think it can't get any worse, it does.
And you got to look at something, you know, substance abuse, right? This is the public health in me coming out. Injection drug users, sharing needles, right? Harm reduction interventions are important too. You know, harm reduction, housing, treatment, all need to be together in order to increase the quality of life of individuals. Because you got to remember now, harm reduction treatment, well, the spread of infectious diseases, HIV, right? Sexually transmitted disease. You know, you have all this stuff going on that is a part of addiction.
Mm-hmm.
Because when you have addiction, it increases risky behavior.
Right.
And when it increases risky behavior, then you're going to have an issue with infectious diseases.
Mm-hmm.
Because they don't care. They just want to get high. So they're going to share a needle.
Right.
Or, hey, they don't have a condom and we're going to have sex and person's going to, you know, pass, you know, HIV on to somebody, you know. Addiction does promote risky behavior. In order to reduce all of that, we all need to come together as one and invite the targeted population to be a part of that solution, because you get insight from them. Right?
Mm-hmm.
You get insight, you get to see, okay, they're telling me their story, and now we can work together, compromise, power sharing, mutual respect, and work together and find a solution to it.
Right.
That's important. That is important, because it is getting worse.
Yes, for sure. I mean, there's so much stress from the uncertainty of our governments, of, you know, it's just so much is an upheaval right now. There's so much, and, you know, addiction isn't just the poor people. It crosses income lines. It crosses social lines. It does not discriminate.
And you know what I wanted to say? There is money out there. The federal government, the states have the money. They are looking for people to make proposals and to get that money to find a solution. I mean, it's out there. I have already submitted 3-4 grants, you know, and I am going to get one, and I'm going to keep on going after them, because I know that the transitional shelter and, you know, I want to connect the detox, it's going to require a lot of money. And the only one who has a lot of money is the government. And my design and my program, the way I have it set up, is based on what I'm dealing with now, what I'm seeing, what areas we could improve on, analyzing. That's where the education comes in, to where, like, okay, well, we can keep it simple if we did it this way. Mm-hmm. You know, I could save government organizations a lot of money when it comes to, you know, economic taxes and all that, because we do waste a lot of money on healthcare. Criminal justice system is huge. Mm-hmm. To house an individual, well, back when I was in that, you know, in there, you know, you're talking about $33,000 a year for one inmate. It's probably changed now. We can't lock people up because they just come out like wild dogs, right? We need to assess, analyze, and have that person be a part of the assessment. Okay, so trust, right? So open up. How can we help you? You know, what areas are you struggling with?
Right.
there's about 71 million people that are under the criminal justice supervision in America.
That's amazing.
So let's look at that.
Yeah, that's incredible.
Let's look. You know, if you look at that, these are people that have been abused, don't have coping tools, therefore they make others hurt, right? Mm-hmm. And they substance abuse, and they get into gangs or they do other things because they want to feel like they belong because they're displaced in their family, in their community.
So when you speak of stress, it seems that stress is at the core and very pronounced in the lives of people who are caught in the throes of addiction and homelessness. And I remember once you mentioned something about teaching them heart math skills. Can you speak to that and how teaching them these tools has been helpful for you and your groups?
Well, stress is a huge issue. When you don't know where you're going to eat, where you're going to sleep, how you're going to pay your bills, you know, that's a mental and physical stress on a person. And in my groups, we have I taught them stress management skills, and we also do problem solving and all these good things together. They're all together. Problem solving, critical thinking, decision-making skills. I have them all together with stress management. And that's where meditation and just stopping for a minute, pushing things to a side, breathe, right? To be able to get a clear, coherent, thought process, is one of those things that I teach in my groups, because most of my clients are overwhelmed by their stress, and they end up relapsing. And it's important that they have these coping skills,
right,
to these problems. And I always tell them there's always a solution to a problem. However, it may not be in your timing. And if you feel like you're getting stressed, you back away for a minute, breathe, go exercise, go meditate, go swim, whatever that individual likes to do, go do, and revisit the situation later. And in my groups, they get into their own little groups and they come up with a problem, and I give them the techniques and the tools for problem solving, and then as a group together, each group identifies their issues and put possible solutions that they could come up with. And then that's where I would come in and be like, offer some extra support and extra suggestions to that.
Right.
Every time I do that, it works. Every time that I reach out and they tell me what they got, and I give them some suggestions and recommendations, they're able to come back later on and tell me, hey, that worked. Thank you.
That's great. That's
but
great.
These skills have to be used. That's what I let people know. Like, you have to use them in order to acquire them. It's just it doesn't feel good, but you have to do it every day. After we do exercise, after we do our group, then we go ahead and we'll do meditation. And I do that in there with them. I have my yoga mats, and I have this, relaxing guided meditation, sometimes guided, and they enjoy it because they were able to stop for a minute, not worrying about nothing. Now, some people say, hey, I had a hard time. Well, you got a lot of stuff going on.
Right.
Yeah, we need to prioritize, and, you need to start, you need to start slowly taking stuff off your plate. There's one thing that I want to say, too, though. The transformative process of addiction to recovery is that they have to understand when you remove a negative out of your life, you have to input a positive. replace it. And this is what I stress with him. You take out addiction. Okay, let's exercise, go to school, keep yourself busy. Mm-hmm. Don't have that idle time. Right. Because if you just stop using drugs, it's not going to work.
Right.
It does not work. It does not work, and it creates more problems, and they just keep on relapsing and stuff. And that's what I told them. You got to find who you are. And that is the process in recovery, is that in the beginning stages, you're just finding out who you are without drugs.
Yeah.
You're learning yourself.
Mm-hmm.
You're finding your strengths and your weaknesses, and you're identifying them. And the process of that, it depends on the individual, right? Mm-hmm. It can take time.
Right.
But I told him the key thing is you know what you don't like, and you know what you do like. So what you don't like, you need to push aside. Mm-hmm. You need to be able to explore your thoughts in your internal self. How we perceive ourselves is a huge issue, and it determines the success rate of recovery. Mm-hmm. Honestly, people think that recovery can just be easy. It's not. I always tell everybody, something earned has more value than something given. You're going to have to work for it.
Yeah.
I let them know where I'm at today is not because of some magic carpet whipped me up over here. I worked my ass off, and I continue to work. And I'm always improved. I'm in the maintenance phase of recovery. I'm always continuing to work myself and always taking care of myself. Mm-hmm. But I had told them that you have to focus on you in the beginning.
Right.
And when you're doing true recovery and you're working on yourself, then the next door opens, and you'll know when that time comes to go to the next level.
Right.
And just because of my past experience and my education and all that promotes that gives them that hope. Mm-hmm. Hope is important. We need to have that hope. Hope is important, because if you don't have hope, things will be hard.
Right. Right.
Motivation for change is important. What's your purpose? What do you want? And that's where that creativity comes in for myself when I'm dealing with this kind of population.
Well, Ana, I just want to say how much I appreciate your efforts, and I appreciate all the work that you are doing to really come up with a viable solution to solve this problem, because, it's going to take, it takes a village, right? It takes a village, and it starts with one, and then hopefully what happens is you bring other like minds to the table, people who can actually offer something to help contribute towards the solution. So we got a couple more minutes before we are into the hour, and what I want to do is I want to ask you to say what one thing to people who are currently struggling with addiction and homelessness. What can you say to them as a last word?
If you're tired of being sick and tired of the life that you're living, you're going to have to fight for your life and ask for help. You are not alone in this battle. There is many of us who have conquered and overcome, and we're here for you. Just reach out for help.
Great. Well, Ana, thank you for honoring me with this interview, and I hope that other people will watch this and perhaps pick up some pieces of wisdom that they can take to their communities to then, start this process of healing that needs to take place, and it's been a long time coming. So I just want to thank you so much for your work. I'm here for you, and just thank you. I just can't thank you enough. And so with that, I want to go ahead and end this interview, and thank you to everyone who joined us. And if you want to reach out to Ana, just send me a private message, and I will definitely will be glad to put you in contact with her. Again, this is Suzette West, the Meaningful Work Maven, speaking with Ana Adams-Davies of Tushka, Ohoyo Adams-Davies nonprofit organization, where she spoke to us about her meaningful work in the world. And with that, I am sending you heartfelt blessings, and may you all have a good day.
Thank you.